Good afternoon, students. Welcome in HCP lecture. Today I will start the lecture of Hospital and Clinical Pharmacy. Chapter Drug in Clinical Toxicity. Okay. Let us first shortly look at what we saw in previous lecture. Introduction and classification of poison. In introduction, poisons are generally used for the surgical purpose. Suicidal purpose. Then poisons are used for homicidal purpose. Then poisons are used for stupefying purpose. Okay. In poison are generally used for suicidal purpose. Potassium cyanide, oxalic acid, hydrocyanic acid, then opium, barbiturates, organophosphorus compound, and arsenic. Then poisons used for homicidal purpose are arsenic, then antimony, then aconite, organophosphorus compound, strychnine, and oleander. Then next is the poison used for the stupefying purpose are datura, belladonna, then hyoscyamus, cannabis indica, then cigarettes containing arsenic. Okay. Then accidental poisoning commonly occurs as a result of carelessness with the poisonous, and non-poisoning has been reported from the greater use of chemical industry and for household purposes. Then classification of poison, in that corrosive, then irritants and neurotics. In corrosive poison is simply a highly active irritant and not only produce the inflammation but also acute ulceration of tissue. For example, strong acids like sulfuric acid, nitric acid, and hydrochloric acid. Then irritants. In irritants in organic, then organic and mechanical poison. In organic, non-metallic and metallic compounds. Non-metallic poisons are phosphorus, chlorine, bromine, iodine, and boron. And metallic poisons are arsenic, antimony, mercury, silver, iron, copper, then bismuth and lead. In organic, divided into the two types. First is vegetable poisons include castor oil, then colocynth, ergot, marketing nut, and alloys. Then second is animal poisons consist of the catharides, snakes, venoms, then scorpions venom and poisons insects. And third is mechanical. These groups include the powder glass, chopped high, sponge, and diamond dust. And last is neurotics. Neurotics, the poisons primarily act on the central nervous system. Okay. Include the headache, drowsiness, then giddiness, then delirium, stupor, coma, and sometimes paralysis. Now, I will start the remaining part of this chapter, that is general treatment of poisoning. In that, poisons in relatively small amount may cause the structural damage or functional disturbance in the body. Then poisoning can be accidental, suicidal, or homicidal. They cause the structural damage or functional disturbance in the body, and poisons can be accidental, then suicidal, and homicidal. The victim needs immediate treatment. Involves the following measures. First is immediate care of deteriorating body functions, then removal of unabsorbed poisons, then elimination of absorbed poison, then use of the antidotes, and last is suppurative measures. Then systemic antidotes. Such substances produce the opposite action of effective effects that of poisons. These are administered with care because the antagonism always not complete. The antidote itself may produce unwanted effect, for example ball, that is okay, dimercaprol, EDTA, salt, etc. These are the systemic antidotes. Then next is insecticides poisoning. In that, may of these insecticides contains organophosphorus compound and DDT. Okay. First is organophosphorus compound. Symptoms. These includes headache, then irritation of eye, nose and throat, then burning vision, then cough followed by vomiting with abdominal pain. Then in severe cases, salivation, then nervousness and convulsion may occur. Then if not attended in time, respiratory failure, coma and finally death may occur. These are the symptoms of organophosphorus compound. First is headache, then second irritation of eye and nose and throat. Third is blurring vision. Fourth, cough followed by vomiting with abdominal pain. Then fifth is in severe cases salivation, nervousness and convulsions may occur. And last is if not attended in time, respiratory failure, coma and finally death may occur. Then treatment of organophosphorus compound. The treatment involved in the following step. First is decontamination, second emesis, third gastric lavage, then antidotes, use of choline esterase reactivator and other measures. First is decontamination. In decontamination, the victim is removed from the source of contamination from further exposure and washing of skin by water with soap is done. Then emesis. Vomiting is induced if poison is ingested by giving tincture of ipecac. These are the emesis. Then gastric lavage. In case of severe conditions of patient, it is carried to remove unabsorbed poison. That is gastric lavage. Gastric lavage, in case of severe condition of patient, it is carried out to remove unabsorbed poison. Then antidotes. The atropine can antagonize the antidotes. The atropine can antagonize the peripheral action of organophosphoric compound but cannot block the effect on CNS and neuromuscular effect. Atropine can antagonize the peripheral action of organophosphoric compounds but cannot block the effect on CNS and neuromuscular effects. The patient should be fully atropinized by the dose of 2 mg every 15 to 30 minutes IM or IV till atropine effect appears, that is flushed face, then dry mouth, dilated pupils, false pulse and warm skin. Okay. Then use of the cholinesterase activators. In that, the oxime compound like pralidoxamine, chloride pyridine, aldoxymethiodatin. A dose of 1 to 2 g IV for adult and 25 to 50 mg per kg for children, given as 5% solution in an isotonic saline. Repeated after every 12 hours should be given. Then other measures Mercurial diuretic can be useful. If restlessness is present, barbiturate should be administered. The rest of the treatment is symptomatic. Okay. These are the insecticide poisoning. It contains the organophosphorus compound and DDT. First is organophosphorus compound. Symptoms: headache, then blushing, vision, then cough followed by vomiting with abdominal pain, then irritation of eye, nose and throats. Okay. Then if not attended in time, respiratory failure, coma and finally death may occur. The treatment in following stage. First is decontamination, second emesis, then gastric lavage, antidotes and use of choline esterase reactivators and other measures. Okay. Now the next point we will discuss in next lecture. Okay. Now I will stop here. Thank you.